Welcome to Healing Horizons, where each week we share the latest news and research in trauma informed care, positive and adverse childhood experiences, and psychological safety. I'm Allison Sabula.
Hi, everyone. I'm Bree Twombly, and we are both part of 10 Collective, where we are working to create a world where we genuinely care for one another. We want to invite you to consider hiring us to support you in implementing trauma-informed care and psychological safety-based programs and policies, so you can better care for your employees, who then, in turn, can better care for the communities and families that you are partnering with. Check us out on our LinkedIn page, or you can go to 10-collective.com. Tried to say all of that in one word. To learn more about us, and we look forward to working with you in the future.
Awesome. So let's get into today's news. Today's Thursday, August 29th, 2024. Content advisory. We will be talking about trauma, which often includes discussion of violence. And like this first piece. So trauma-informed care news support for victims, survivors of family, domestic, and sexual violence in Moree and Central Coast. And this is news from Australia. The Australian government is investing $10.6 million to ensure that victim survivors of family, domestic, and sexual violence living in the Central Coast and Moree regions of New South Wales will have access to free, specialized mental health support close to home. The pilot recognizes that victim survivors of violence need support well beyond the initial crisis response. Amazing. To continue their physical and mental health recovery. The Supporting Recovery pilot will provide case management, care coordination, and trauma-informed mental health care to victim survivors for up to 2 years. So this is really great. And what we want to impart to all of you who are tuning in is that, if you are in, like running programs in your county or state or area, you can look to what's working and what's happening out there in the world to inform interventions that you may want to design. We can actually put together a literature review and review the programs and the research to help inform the programs that you might want to create in your area. But something like this, obviously we don't have the data yet to know if this is going to be a great intervention, but it's a really, really great example. And what you could do is look at something like this intervention, and probably you could dig up a lot of the literature that informed this intervention and use it to design yours. But to me, just reading the brief summary, this looks like something that's going to be really great. That probably follows the best recommendations from the literature. Don't you think, Bree?
Yeah, I agree. I like that there's like wraparound care, thinking about what are all the services that someone could potentially need related to their mental health and processing the trauma. And that it's not just like the initial crisis response. We have a lot of things that are like, here's this trauma, this crisis that's happened. Here's this thing that we can provide. And we know that trauma just doesn't go away immediately after the crisis is over, or kind of like the crisis response. So I like that. I'm curious about the 2 years that they chose. Kind of where did that number come from? I know probably for funding, they had to like probably have some sort of boundaries or limits related to it. Just another thing related to funding that continues to exist. But so I was curious about that. I think that this is great, and seems like they've been using a lot of the research, and we talk about Australia a lot on here. So they are collecting a lot of data and doing a lot of research in Australia related to trauma and trauma-informed services.
Yeah, absolutely. Okay, so now we're back in the US here. So Macon, Georgia, Mental Health Matters receives funding to provide free support services in community. So the mayor, Lester Miller, said mental health wellness is something we need to normalize. And I think we have been getting closer to that thanks to the work that MMHM, which is Macon Mental Health Matters, does. We are proud to continue funding this initiative so everyone can get the resources they need without any barriers. Plans for the upcoming year include another adverse childhood experiences study, which is what ACEs is, adverse childhood experiences, starting a mental health symposium, and more. So from MMHM's website, quote, understanding and addressing ACEs is crucial for fostering a healthier, more resilient community. At MMHM, we are dedicated to comprehensively studying ACEs within our community. Our inaugural ACEs report goes beyond traditional surveys, offering a trauma-informed approach to understanding the impact of these experiences. We not only collected data, but we also provided participants with empowering tools, practical mental health techniques, and personalized support through our unique Taranga counseling sessions. So that must be a unique offering that they do. So definitely very interested that they are collecting data, and really interested to know if they'll look at systemic patterns, not just individual patterns. Probably they will. So yeah, love to see work being done that includes data collection. So that's great.
Yeah, and it seems like data collection with a purpose. They're being very purposeful about what do we want to know, how are we going to use this data, and how do we collect it, which is always the important thing.
Yeah.
So the next is New Hanover County officials celebrate Community Justice Center, set to open in a few weeks. So this is out of North Carolina. So District Attorney Ben David unveiled the Community Justice Center, which will assist survivors of trauma and ACEs through wraparound services from law enforcement, prosecutors, and counselors. David says the goal is for those working in the criminal justice system to collaborate together, not only to respond to crime, but to prevent it through community involvement. There are over 100 family justice centers around the United States, but David said what distinguishes this center from the other centers is that there's a focus on healing adverse community experiences along with adverse childhood experiences. So he said it really takes all the areas of outreach around this idea that the social determinants of health are the same thing as the root causes of crime. And when we make people healthier, we make them safer. So I really loved the quotes and how he was talking about it, because there is that focus on how are we healing, how are we addressing these adverse community experiences. So things like incarceration and poverty, which are often the roots of ACEs. So if we can eliminate and address those, we can eliminate exposure to ACEs for people. So really liked that they are not only looking at the individual level, but also the systemic level through their programs. The next was an interesting article that is called Trauma-Informed Tattoo Artists Combine Ink with Empathy. So this talked about a more mindful approach to tattooing and how it's an emerging trend in the industry and across Greater Boston. This article was from the Boston Globe. In a more general sense, they talked about how several tattoo parlors have incorporated customer-facing language that relays inclusivity, safety, and client agency on their websites and social media. So the individual concept of trauma-informed artistry spans things like education and practices that are centered on consent, empathy, PTSD, so post-traumatic stress disorder, and trauma-adjacent challenges that can arise during body modification. They also talked about how sometimes tattoos can come with emotional weight, and an artist must then generate a permanent physical reminder of a design's deeper meaning. So there were some quotes from a Boston-based therapist who also is a tattoo artist named O'Hare. And while there is no kind of official certification for trauma-informed tattoo work, to O'Hare, the label really means an ethical standard that impacts how she conducts her practice. She explained her philosophy as a way that tattooing can be a way for one to reclaim their body. O'Hare also talked about prioritizing clients' agency by requesting consent to touch and proceed throughout the tattoo process.
Amazing.
Checking on the client's emotional and physical comfort throughout the appointment. So important. So really loving to see that. There was an assistant professor at Boston University's mental health counseling and behavioral medicine program, Professor O, who talked about how a strong sense of self is essential to a person's healing, with tattoos serving as an empowering outward expression of identity. They also allow people to reclaim control of their body, which can especially be useful for survivors of sexual assault. Additionally, they talked about how those experiencing a loss, how a tattoo can help to communicate the loss to others, which can serve as an essential part of the grieving process. Tattoos can also be a tool for connection. So there was a quote from Professor O saying, "My client had a tattoo after her experience of trauma. She said that is a way to connect with other people who experience a similar trauma." And so I really just love this because it's taking those two principles. We're thinking about things like voice and choice, empowerment, and really putting those into action through the process of tattooing. So, interesting article that I encourage you to check out.
Yeah, I was reading that one this week as well. And as someone who has many tattoos myself, as well as the trauma, I really love these two worlds coming together. And of course, I think there are some links, between these two things. So it's really nice to see this acknowledged. Yeah,
Mhm.
and to see this purpose and intent go into this space. It's amazing. Okay, here's what the CDC's new IUD pain management recommendations mean for patients. So the CDC is the Center for Disease Control here in the United States. IUD stands for, is it inter or intra? Intrauterine device. Okay, yeah, okay. Always trying to decode the acronyms. So intrauterine device. They are increasingly popular form of birth control. This is birth control that women that are inserted into women. So getting one placed is often a very painful experience. According to one recent study, 78% of patients who had an IUD inserted described the pain during the procedure as either moderate or severe. On social media, 97% of the TikTok videos tagged with IUD included complaints about pain. You know what? I have been seeing IUD content lately on multiple social media platforms, so it is getting a lot of attention. So it's nice that the CDC updated their guidelines. Someone's on TikTok. Yeah. So social media for good. Those complaints led the Centers for Disease Control and Prevention to update their guidelines on pain management during IUD placement procedures earlier this month. There has been increasing awareness about the pain patients experience during the procedure, and there is a history of women's pain not being taken seriously, says Dr. Robin Schickler, the Chief Medical Officer of Planned Parenthood of Southwest and Central Florida. We're seeing a cultural shift thanks to social media where more people are sharing their experiences. The research is confirming what many women with IUDs already knew: the discomfort during placement can be much more than just a little cramping. So the introduction of sedation services is seen as a crucial step in making IUD placement more accessible and comfortable. Sedation services break down barriers, allowing patients to receive care in a way that's more comfortable and empowering for them. The release of the new guidelines is part of a movement towards implementing trauma-informed care in many different areas. So love that there's a movement to implementing trauma-informed care in many areas. We're part of that movement. And yes, pain has been dismissed in women for a long time. So this is good to know. Okay, insights toward trauma-informed nursing supervision and integrative literature review and thematic analysis. So this was in the International Journal of Mental Health Nursing, August 2024. And the research's aim was to explore the literature. So this means to look at all the different research studies that have been published and see what the trends within the literature are, see what scientists agree on. Related to trauma-informed supervision in nursing, to answer the question, what skills and strategies can a supervisor use to support nurses who provide trauma-informed care in adult populations? An integrative review method was used and identified 15 published articles for inclusion. Analysis revealed 3 themes that were developed into an emotion cognition action sequence. So, 1, create a safe supervisory relationship. And I talked about that this week in my, on Tuesdays, I talk about the 8 realms of employee wellness. So, we talked about reflective supervision, which is Bree's expertise, and mental health and growth. And having a safe supervisory relationship is such a huge part of employee growth. So check that out it's also on our LinkedIn page. It's also on our YouTube from Tuesday. Number 2, facilitate trauma-informed care learning. And 3, build resilience. And I'm curious, actually, if they end up defining resilience in the study, because that word can be kind of thrown around. But technically what it means is that once a stressful event happens, that you can kind of bounce back from that stressful event without it maybe like creating a cascade effect across your life. So I'm curious if that's the same definition they're using, probably something similar. So discussion noted the intersection of review findings with the Supervision Alliance model and trauma-informed care framework, and where other skills may be integrated to inform a trauma-informed supervisor. So actions towards strengthening emotional intelligence and resilience were described. Parallels drawn to how these same resilience building practices also strengthen one's relational skills, helping the populations served. So, yeah, emotional intelligence and relational skills tend to be a lot of what resilience is made of. When we talk about trauma, we're often talking about early relational wounds that then become patterns throughout our adult life that continue to hurt us as we set ourselves up to repeat some of the dysfunctional dynamics that we may have experienced growing up. So anytime there's an intervention that's looking to increase emotional intelligence, increase attunement, maybe between a supervisor and an employee, these are going to be things that really help build a lot of resilience to trauma.
Yeah, we're going to move into our ACEs and our PACEs kind of peer-reviewed research area. And this first study connects really well to the one that Allison was just talking about. So this one is domestic, family, and sexual violence, polyvictimization, and health experiences of Australian nurses, midwives, and carers, a cross-sectional study. So we're in Australia again for this one. And I just do want to kind of define polyvictimization. It's often refers to experiencing multiple types of trauma. This was in BMC Public Health, August 2024. There were 10,674 nurses, midwives, and carers who participated. 5,982 participants had experienced at least one type of lifetime violence, and half had experienced 2 or 3 types of lifetime violence. They found that survivors of child abuse were 3 times more likely to experience both intimate partner violence and non-partner adult sexual assault. And then any violence that had been experienced was associated with poorer health and well-being, and violence in the last 12 months was associated with the poorest health and well-being. Again, that connection with experiencing violence and ACEs and the impact that it can have on overall health and well-being. The researchers talked about how the findings demonstrate the need for more accessible and effective workplace interventions to prevent and mitigate psychosocial ill health, especially in the recent aftermath of violence. So this really just connects back to what Allison was just sharing related to supervision, making sure that there is a reflective place, that supervisors understand trauma, the impact of trauma. They understand things like secondary traumatic stress and signs and symptoms of that. And again, just stressing the need for workplaces to be trauma informed and responsive, not only for the people coming to access the services, but for employees. And when we're thinking of caregiving fields like mental health, healthcare, there's a huge percentage, as we can see from this study, of those who are in the field who have their own trauma histories, and are bringing that into the workplace, and could get activated by hearing stories or seeing things in the workplace that brings up some of their own experiences. So really important to have workplaces that understand that, and then are responsive to those situations. So just a nice little link between those two articles for this week. And Tend is able to kind of support with those if you're thinking about kind of those well-being strategies. If you're thinking about supervision strategies and how to support, we can partner with you to do some training and coaching for that. Our next one is how better health strategies could reduce juvenile crime. This is another one that is a little bit related to when we were talking about the courts earlier. So this is from JMA Health Forum, August 2024. So they talked about how despite data showing a fairly steady decline in violent and major property crime in the US since the 1990s, that the public actually perceives that crime is now on an upward trajectory. So as a result of this, a lot of states and cities have passed or are considering laws aimed to deter delinquency. So thinking about things like curfews, higher penalties, things. So very punitive approaches. And the authors talked about how these punitive approaches are often ignoring the relationship between psychological trauma and adolescent brain development, and how such trauma can increase the probability of criminal behavior, as well as depression and other mental health conditions. So often the two things are not looked at. There's the behavior, but not really understanding what's going on. And so there is a push to kind of be thinking about both at the same time. So this was talking about how being able to hold that ACEs can affect judgment and behavior, how courts are increasingly turning, especially for first-time offenders, to pretrial diversion programs that address education, health, and other risk factors in the least restrictive setting. But there are still a lot of barriers they talked about to preventing behavioral health conditions that can lead to crime and incarceration. So there's a lack of funding for mental and behavioral health, a lot of staffing shortages that make it hard to get treatment or can kind of delay progress. Poor integration of behavioral health and child support services, such as like the foster care system, that can then result in some youth not receiving needed services and can increase the likelihood of later rearrest and incarceration. The researchers did note, on a positive note, that Arkansas has recently published a roadmap that they created that talks about collaboration between Medicaid, child welfare, and the juvenile legal system to help coordinate services. So how are people working together, talking to provide, again, those kind of wraparound services for the youth? They talked about how which this was a new thing that I learned, how a juvenile might be eligible for Medicaid or the Children's Health Insurance Program. There's this rule called the inmate exclusion rule that prohibits them from receiving health services under those programs. So when they're an inmate, they can't receive those. So any previous treatment gets interrupted when they go, and released youth are less likely to obtain treatment and are more likely to become repeat offenders. They did cite how at the beginning of 2025, there would be new changes to authorize Medicaid and CHIP to cover certain services before and after the release, which includes things like behavioral health screenings and case management. So hopefully that will address some of that problem they identified. And then the researchers also talked about how in healthcare, it's important to look upstream and address factors that lead to ill health rather than focus only on treating its consequences. This approach includes recognizing and dealing with factors such as child abuse, neighborhood gun violence, and other traumas that can lead to crime, especially crimes committed by children. So love to see that they're talking about understanding trauma, understanding how it impacts behaviors, then creating systems that are designed to recognize and then respond. And again, looking at the roots of some of the behaviors I mentioned. So how do we address those?
That was a long one, Bree.
Yeah, there's a lot. I would encourage people to like really read all of the examples of what they talked about. That was a little hard to summarize and not leave out any kind of details.
I'm having a pretty large amount of background noise coming up, I think, because I'm in a co-working space at the moment. Do you want to take the next one, Bree?
Sure. So the next one is the impact of adverse childhood experiences on multimorbidity, a systemic review and meta-analysis. This is from BMC Medicine, August 2024. So this was a systemic review and meta-analysis where researchers were trying to identify, synthesize, and quantify the current evidence linking ACEs and multimorbidity. So they had 15,586 records and found that 25 studies were eligible for inclusion. The total participant number for inclusion was 372,162. So this is the first systemic review and meta-analysis to synthesize the literature on ACEs and multimorbidity that showed a dose-dependent relationship across a large number of participants. So again, dose-dependent doesn't mean that you will develop a condition, that something will happen to you. It means kind of the higher your exposure level is, the higher your ACE score is, if we're using ACE scores, the higher your risk is of developing long-term behavioral, physical, social challenges. So it consolidates and enhances an extensive body of literature that shows an association between ACEs and individual long-term health conditions, risky health behaviors, and other poor health outcomes. So they talked about how although 25 years have passed since the landmark ACEs study by Felitti, there is still no consistent approach to determining what constitutes an ACE. It's reflected in this review where fewer than half of the 58 different ACEs were reported by more than one study, and no study reported more than 15 ACEs. Even ACE types that are commonly included are not always assessed in the same way, they found. And furthermore, the same question can be interpreted differently in different contexts. So really important information and something to definitely think about and consider. They also talked about how ACE research is often based on ACE counts, where the types of ACEs experienced are summed into a single score that is taken as a proxy measure of the burden of childhood stress. So the original ACEs study took this approach. So that's what I was just mentioning with kind of the ACE score, as did 17 of the studies included in the review. At the population level, that makes sense. There's benefits to that. And that was really the purpose of the original ACE score, was looking at like a population level. It wasn't really meant to be used as an individual kind of like assessment or tool. So at that population level, ACE counts can provide quantifiable and comparable metrics. They can be easy to collect and analyze. And in a lot of data sets, they are the only means by which the assessment of childhood stress can be derived. However, when we're looking at it at an individual level, there's kind of an inherent assumption that different ACEs in the same person are of equal weight, or that the same ACE in different people carries the same burden of childhood stress. So when we're looking at this, we don't always want to rely on an ACE score. We want to understand what the experience was like for the person, what was the impact that it had on them, what were some of those positive buffering experiences that they may have had. So really important, critical questions that they are looking at, that they're encouraging people to take a look at in this study. So a great one there. Allison, I see that you popped back on. Do you want to take the next one, or is it?
Yeah, sure. I mean, yeah, the noise level just kind of exploded here all of a sudden. So party time. So can you hear it a lot?
Yeah, I can hear it. It's not as loud as it was before, but if it starts to get really loud again, I'll let you know. And
okay, sounds good.
Off, yeah.
Yeah. So thanks for covering that one. That one's really a doozy. um, trauma exposure among young children in rural Pakistan. So associations with gender, mental health, and cognitive skills. So this was in BMC Psychology, August 2024. Researchers drew data from a sample of 888 mother child dyads in rural Pakistan to investigate these associations among 6-year-old children in South Asian low resource settings. So 90.5% of children experienced at least one trauma. So the most common traumas were death of a loved one, with 47% of those surveyed having experienced that, and hearing about war and terrorism on TV or radio, 48%. On average, boys experienced more traumas than girls, and specifically, boys were more likely than girls to experience an injury or hospitalization and to hear about war or terrorism on the TV or radio. So, trauma was associated with increased mental health difficulties and increased anxiety scores. There was little evidence that trauma exposure was associated with child cognitive skills. So, the results suggest.
So the results suggest that trauma-informed interventions are important for supporting child mental health in South Asia. With that one. So again, another study showing those connections between early childhood trauma and the impact specifically on mental health with that. And this one was interesting, talking about how there's little evidence that trauma exposure was associated with child cognitive skills. And we shared a few studies over the last few weeks where they've really been looking at cognitive skills. And this seems to be consistent with some of those other findings too. The next is childhood maltreatment is linked to larger preferred interpersonal distance towards friends and strangers across the globe. This was in Translational Psychiatry, August 2024. And when we're thinking about comfortable interpersonal distance, the research team defined that as the physical distance humans prefer towards others during social interactions. So this study looked at 2,986 adults with varying cultural backgrounds residing in various countries. They found that higher childhood maltreatment was linked to a larger, comfortable interpersonal distance towards both friends and strangers. Moreover, they also found that insecure attachment as well as less social support were associated with larger, comfortable interpersonal distance. These feelings demonstrate for the first time that childhood maltreatment affects comfortable interpersonal distance across countries and cultures. So when I was reading this one, I really just kept thinking of the concept of safety. When your safety within relationships has been threatened, it makes sense that you want more distance else in order to read what's going on, to be able to respond what's going on. So interesting study, and nice to see that they were able to see that that was pretty consistent across countries and cultures.
Yeah, really interesting. I can grab this one. Interrogating and uprooting systemic racism in the emergency department. So this is in JMA Health Forum, August 2024. Researchers discussed examples of systemic racism in the emergency department. So they analyzed more than 300,000 emergency department visits, and the study found marginalized populations were more likely to be bypassed and less likely to bypass others. It sounds like it's getting louder. Can you hear more of it?
Yeah, I can take it. That's okay.
Okay.
So when they're talking about bypassing, that means like how kind of like the number that you are as far as like getting help. So more serious versus can kind of wait a little longer. So they said some of these kind of bypassing jumps may be clinically appropriate due to things like patient deterioration. But others provided examples of interpersonal racism in which subconscious biases may affect triage decisions, resulting in queue jumps and differential wait times by race and ethnicity. This is also making me think, I wonder if they looked at this by gender, what that would look like. We were talking earlier about the pain study and just not really believing women in their pain rates. So I wonder with that, there probably is a study that could answer that question for me, which I'm going to look into now that I have had that. They also found a study that reported that Black patients were being flagged for violent or disruptive behavior at higher rates, leading to less time spent in the ED and a higher overall discharge rate. Another systemic issue they noted is the lack of training in trauma-informed care for managing patient behavior and understanding the underlying drivers for aggressive or inappropriate behavior. That seems to be one of our themes that we're talking about in the news today. So without that training, staff may flag behavioral or violent issues without considering root causes and thus perpetuate inequities. So they talked about how, in fact, at a structural level, patients who are marginalized, particularly those exposed to trauma throughout their lives, are more likely to have a psychiatric illness that manifests as behavioral issues in the emergency department. The article did suggest that partnering with historically marginalized populations to help design solutions and strategies to address disparities can help to rebuild that trust that has been broken, as well as to help to challenge health systems to confront their biases, ensuring care is equitable and responsive. So some of the goals that they suggested were things like diversifying the emergency department workforce, enhancing transparency in emergency department care processes and goals, and building trust between marginalized communities and the emergency department serving them. There's been a lot of broken trust and mistrust and a lot of systemic racism within the healthcare system, as well as specifically in emergency departments. So there's definitely a lot to do here, and being able to center the experiences of marginalized individuals and to understand their experiences and their solutions is a great place to start doing this work, I think. Then the next is risk and protective factors associated with substance use among Puerto Rican youths after Hurricane Maria, a cross-sectional study. This was in BMC Public Health, August 2024. So they looked at a total of 36,485 participants, about 50-50 as far as male-female breakdown, and they were in grades 7 through 12. And the findings showed that when compared to students that endorsed low or no substance use, those who reported having adult social support demonstrated a 58% reduction in odds of reporting high substance use after Hurricane Maria, which is in 2017, I should note. While students who reported having teacher or counselor social support demonstrated a 21% reduction in odds of reporting high substance use. Those that reported having peer social support demonstrated a 31% increase in odds of reporting higher substance use compared to those that reported low or no substance use. So while social support was generally protective, prevention efforts to build positive family and community connections may be indicated. And I think this really aligns with a lot of the research that's already out there related to positive childhood experiences, especially having those strong relationships that are modeling healthy coping skills, being able to talk about feelings, label feelings, and just having that support when scary things happen. Okay, so moving into our last section, our psychological safety section for today. So we have 2 articles in here. So the first is called Safe to Belong, Contribute, Learn, Challenge, and Transform, Fostering a Psychologically Safety and High Performance Sport Environment. This is from the International Journal of Sport and Society. This is actually from April of this year. So researchers analyzed semi-structured interviews with 29 coaches and sports leaders to ask what are the specific leadership and coaching practices that foster psychologically safe and high-performance sports environments. So through the study, they really are saying that kind of performance, health, and well-being are not mutually exclusive. They also talk about different practices, structures, and behaviors that can foster both safety and performance. So it doesn't have to be one or the other. It can be both. The findings really built on and adapted Tim Clark's 4 stages of psychological safety framework to a sports context by highlighting the importance of being and belonging as a basis for contributing, which is really essential for individual, for team, for organization, as well as system learning. It helps to lay the foundation for challenging norms and assumptions in order to optimize human performance and enable system transformation. And so
I also wanted to say, sorry, it's super, super loud, but Psychological safety when it comes to sports and athletics is also physical safety. I'm an athlete myself and have been around a lot of athletes. And the thing is that when you start to feel a lot of stress and toxic stress, your body breaks down and you'll get more injuries. I have seen this come up so much where someone's going through a really tough thing in their psychosocial world, and then all of a sudden they start getting injury after injury. So it's also physical health.
Mm-hmm. Yeah, absolutely. And I think we've seen, at least in the US, where we're thinking about mental health and psychological safety, like differently related to sports. And a lot of that credit to Simone Biles, for the Tokyo Olympics, and her saying, this isn't safe for my body. I'm going to prioritize my mental health. And she's continued to do that. And really there's a different type of conversation that is happening.
She shifted the whole culture.
Absolutely. Yeah. So I feel like we couldn't talk about this without mentioning Simone Biles, and just that leadership that she has shown through that, and just, yeah, she's amazing. So yeah. Our last one is skills training links psychological safety to revenue growth. And this is from the MIT. So Massachusetts, I'm getting the M states I've lived in the past all confused. Massachusetts Institute of Technology Sloan Management Review. So organizational performance can be improved by viewing psychological safety as a trainable skill that individuals develop with practice. So training and psychological safety skills to increase perspective taking, which the authors defined as intentionally putting aside one's own perspective to envision another's viewpoint, motivations, and emotions. So skills-focused interventions that involve senior leaders can be an effective way to get important work done by creating a climate of psychological safety that is enabled by perspective taking in the context of a team's actual work. This approach promises long-term benefits, so things like greater innovation, faster transformation, improved inclusion, and it also has short-term measurable performance gains, which are perhaps, as the authors say, more important in terms of creating momentum for change. I think important for creating momentum for change, and I think important for buy-in. I think people want longer term cultural change sometimes, but it can be hard to get there. But if you can see shorter shifts and changes, there's often kind of more commitment and buy-in and sustainability. So I like that they're talking about like, this is a trainable skill because there is a lot of that. It's perspective taking. It's not just my experience and my feelings, but what's going on for this person who I'm having this conversation with, for this team that I'm leading, and understanding that and being able to be responsive to that. So trainable skill with a lot of high payoff. And we can, again, support you thinking about psychological safety. What is it? How do you implement it? How does it look in policies?
We will give you all the trainings in psychological safety. We can help you with all of that. So talk to us. All right. Thanks for grabbing so many of those, Bree.
Yeah, no problem.
Really just became a party in here. So, well, we will see you all again next week. Thanks so much for